also of a different composition. So the Ministry of Health submits a list to the Chinese embassy every 12 months in advance of specialists that we do need. So we've had specialists in cardiology, neurology, surgery, even ENT surgery. So we're most grateful. Thank you, Dr. Lee.
Yeah.
Tim, you want me to talk to anything, or if I don't follow,
Yeah, maybe you can ask my teammates. Yeah, all my doctors with me. Yeah. Yeah. Maybe you can take a photo.
Yeah.
Together. Yeah. Maybe.
So together first, and then we'll do one with the team.
Yeah.
Okay.
Okay. So first we two.
Yes. Please.
Yeah. Okay. Okay.
I think we're supposed to shake hands or something.
Yes, please. That would be
We shake hands.
Yeah.
Okay, 1, 2. Thank you.
Darcy, look, 1, 2, 3.
1. Okay, second. Okay.
And we'll
Yeah.
take one of the team.
Yeah.
Yes.
Come here, please.
Yeah.
All right. Okay.
Yeah.
Fantastic.
Yeah.
Okay. Everyone fit?
Yeah. Okay. Is it okay?
Okay, 1, 2, 3, smile. One more. 1, 2, 3, smile. 1, 2, 3. 1, 2, 3. Thank you.
Okay.
Yeah.
Thank you so much.
Thank you very much. Thank you.
Okay.
So much.
Yeah.
Thank you.
Yeah.
Thank you very much.
Okay. Yeah. So that's okay. Yeah.
Thank you. Thank you so much. Appreciate it. Is that okay, team? Oi, sim, só tirou.
Well, you have any questions, you can ask my teammates. My doctors. No worries.
So they started May last year, right? And
Yes.
finish in May soon.
Yes.
Just 2
1 year.
Yeah.
We're the first team to be here for 1 year.
Yeah.
So very glad. Yeah.
The previous teams were only here for 6 months at a time.
Yeah.
The last 3 teams, I think, for 6 months. Yeah.
Yes. Yes.
Okay. Yeah.
And from our team on, maybe next team, they all will be here.
1 year.
Yes,
That's correct.
Yeah.
You feel free to ask him.
So you're the first team who is here for a year?
Yes, one first team here for 1 year. Yeah.
So when it first started, they were here for 2 years. And then and then they started back again, 3 teams ago? But for 6 months at a time. Yeah. But this is the first time after a long time, a year. Yeah. But when we first started,
Yes.
years ago, it was a long.
Yes.
But this is the 8th team, huh?
Yeah.
8th
We are the
Chinese
eighth team. Yeah.
Saya rumah aku maka with cardiologist, makfaku, neurology, surgery of what was it? Thank you so much.
If you're not at all ultrasound machines,
It's a name and you want to have a seat? Wait, if you excuse me, that's okay. Thank you very much, Tim. You can go. I'll stay with Dr. Lee if you want. You can stick around.
Okay.
Yeah. Thank you so much. Thank you, Tim. Thank you. Thank you very much. Thanks so much. Thank you. Thank you. Thanks very much.
大家辛苦啊。
谢谢. Thank you. You come here, doctor.
Yeah. Okay.
Sorry, doctor.
Chị sẽ phép không? Ôi cái câu anh
Appropriate. Aku lagi sini mau. This one, Doctor, a very dangerous report. Bueno, i få en interview thing they've got planned. So the way I didn't spread the finger casting. So I want all of you up with the finger.
Yeah, yeah.
I think it's exclusive look. So what's your name again? What is your name?
My name is Dr. Li.
Dr. Li.
I have Ali. What's the same to I have EE? Yeah.
How do you like it sound?
So far, I like.
You like the weather?
The weather.
You know weather.
Maybe just the people in Samoa very hot. Yeah. Yes.
You married?
Yes, I'm married. I have 2 kids. One girl, 1 boy, 2 kids. Only one wife.
Only one.
Yeah.
Can we sit together with
Yeah.
you?
Okay. Okay. That's okay. All right. Okay. Okay. Yeah.
Oh, thank you, thank you. Ready? Okay. I'm sorry, I'm just gonna ask him, because we have news in English and Samoan, so I'll just get him to. No, if you like to do semi ultrasound,
Ultimately, I want to see ultrasound on the or that form. So, se fez one for a what I want for maybe in my own saying. Well, stuff out for Malaysia ultrasound for lots of my near emergency. So, for family, if I feel more as I see, I'll buy more probably for city in Fenga, Malaysia, here for your finger in an emergency. You don't tell your finger for fact. That's a good question. If I pay fat all, I guess, go back to Situla. Or is not paying more fat, we're going to move for female like two, this yaki, but I have two, I have two, or my number, the detail in total. As you've seen that Dr. Lee, they want to ask how much is the machine, the cost? Yeah.
Maybe approximately maybe let me say maybe 100. Sorry. Maybe yuan.
Yuan. Okay. 100,000 Chinese yuan.
Yeah, Chinese yuan. Yeah.
Kilo my dollar if I really want to 100,000.
Oh, 100,000 yuan.
Yeah, around, maybe around, yeah.
So is it safe for us to say estimated cost is over 100,000 Sana yuan?
Let me say, so maybe 2.5 maybe 2.5 yuan equals $1.
Okay. So just under 40,000 Taiwan.
Yeah. Yes. Yes.
Mana omia ni sini nasi tahu in terms of mana omia oli sini ni terms of
Emo to apa nak mira because oleh ultrasound dia mau susu yang efek mungkin fai ele o farmácia vida so esse or se senga le ultrasound ma fa ta pon sa ma le CT fa ma mo fa ta fa ma ia wila manolos ultrasound fa ma what we call sound waves so as if more for fine mai to ia more ta mighty so it's only at a palango the first line investigation so after it is suma senga se ton fa mai usually only fa ta pon sa ma ultrasound le amata to yesu so after you mo se fula se tulo se canisa so fa solo na ia CT scan or se foi level so so it's all fear and value so and it's safe.
Lo ya fue si la fia la fue na le fa mai no sim.
Sa me ia o si la fia ia au fa pito na na ia so ele mo ia le to tine foi le man for that to o training to learn the ultrasound. Currently ngale pe ngale to tanga ta fenga doenga to fa mai to AIC site to or they work to a clinics to mold so more ultrasound service on it but it to tell malo to know su mai mole so we have a large backlog of cases so waiting list at if I think ultrasound.
How many would you say for the backlog?
So people wait up to say 2 to 3 weeks for the most appointment of ultrasound. That was the last estimate this hour. So it's a fast phone side of my fighting, but so the because if we tap in and have a so for our own the management time for the eye, yeah, material for your feeling my tongue and fast phone. So in there, make two make some fire, yeah, and my get to
Ito po yung for my fight to my ultrasound machines.
Yeah. Nga auto CV the fan ma ile to CV the ultrasound. Our fan ma to my ultrasound.
Would you say is that a concern that the ultrasound machines to for my fight to my say for example if I use it in a job or in a very crucial situation and not only the ultrasound and for the ima mau le me lo ma going to work ole atu tasi mai ani sino into to
well there's timing elenga luema tanga luenga o iale fiswani mai matupana or WHO or fata o si portable ultrasound machines if I afford to if I my midwives just to do the initial scans. If we see equipment there, thing siakita and factor but only aim there that all that every pregnant woman should have an ultrasound scan access to an ultrasound scan for safety.
How many ultrasound machines would you say ulo hana only appear in Johnson's? To cater for 200 plus thousand population country.
Probably at least another 2 here and another one in Tulsi. So there's one in emergency autotono for fata e dua.
If I
and all the machine they go to see. So 2 in the department, 1 in ED.
So 5 altogether, both to CV and to
yes.
And there's a need for 2 more.
Yeah, probably 2 more. Because we also have to take into mind the wear and tear machinery. So when it breaks down, there should be another one. And we're currently training more staff to do the scan. So the more staff we have, the more machines, the more patients we can go through.
Now, when you say you have a long list of backlog, what's your estimated number of backlog list? Would you say more than 20, more than 10 patients?
Yeah. probably sensitive to the use of the word backlog, probably just say waiting list, you know, like, so there's people who come. So for example, we only have there's two full-time sonographers. So one patient may take anywhere up to 15 minutes. So you can do 4 patients within an hour, and then over from 8 to 5. That's what, 8, 9 hours. So you can only do, so how is 8 patient, 64. Yeah. So that number of patients, and then per day. And so there's still a lot more patients coming in who require ultrasound. So we book them forward. Our last count so far was some people were having to wait up to 2 weeks for ultrasound, because of the increased demand.
And per day, how many ultrasound patients that needs this service per day? Per
day, I have to look, because it's time slots, and so it's booked according to time slot, 15 minutes. So these are just book cases. They'll offer it to emergency, so they have to fit that in. So 1 person per hour, that's 4 hours, 32. So 1 person can do up to 35 to 40. So we have 2. So 35 to 40 cases each. So we have 2. So that's almost upwards to 100 cases scanned per day. But we still have a lot more people to fast forward.
And that's a lot for just 2 full-time.
Yes, correct. Very
training.
Trainings, yeah. And also overnight 2 emergency cases. Yeah.
And so these 2 full-time training workers, so they have to work 24 hours?
So
one has to work in the morning and the other one has to work in the evening?
So they do an on-call system. So 2 will work in the daytime, and then one of them has to carry on from 5 p.m. till 8 o'clock the next day. Similar to the doctor's on-call, because of the shortage. So there's 2 full-time, and there's another one there training.
Dr. Lee, since there is still a need for more ultrasound machine, would you put in a good word to your government that there is still a need for more ultrasound machines that to be presented to our hospital?
Yes, thank you very much. Maybe you had an opportunity to donate more machines to Samoa, because we know we need more ultrasound. There are more patients who need to do the sky. Maybe I can talk to the government, and the government know how to test, and we're glad to have the opportunity to be here, work here. Maybe.
From the time that you started here in our hospital, what are some of the challenges that you see here in our hospital?
Challenge maybe no, because Dr. Lee is a good man.
Aside from
aside from very good at this.
Don't worry, you have to be honest.
Yes. People in Samoa are very good. Kind-hearted. So no other challenges.
I guess my question is, during your time here, what are some of the things that you see that needs to improve in our hospital? As a doctor.
Maybe we need to have more doctors, such as major in ultrasound.
More staff.
More staff. And last time, maybe which doctor tell me so that they want to study echo. So he asked me, so if they have the opportunity to go to China to study, so maybe yes.
Would you be able to provide that opportunity for our doctors and our staff here to be able to train?
During the period we are here, we can teach the young doctors, no problem. But after I come back to China, I can tell the government, yes, maybe you can have the program to prove the students for young doctors.
Exchange program or training program.
Yes, maybe. That's what we want to do. To improve the services in Samoa. Yes.
Cool. Thank you. How many patients have you served since you've been in Samoa?
how many patients? We have 8 doctors in 8 different departments, many, because I made almost 10 months. Yeah.
What do you think is-
Cardiologist, sorry, but I just meant the cardiologist, he's done over 500
Over yeah,
heart scans.
yeah,
for-
yeah. Our echo have like 500. Yeah, that's the new record. Yeah, and we started first ever echo clinic. Yeah, every morning clinic.
Clinic,
First
yeah.
every morning, every Monday morning. Yeah. The patient can order and come here. Yes, and we studied the treadmill
Treadmill studies,
yeah, treadmill
Treadmill,
studies. Yes,
clinic,
yes. What was the time I saw the machine in the clinic and no use? I think it's a waste. Yeah, I think so. And we studied the treadmill. That's a good technology. I think it's good. And
So prior to this, we had Professor Satuviali who assisted us. It was like once a week up to. So we would be looking for a full-time cardiologist. So hence our request to the Chinese for a cardiologist who they sent to assist with us.
yes.
So we're quite grateful for that.
So we don't have a cardiologist?
No, we don't have a full-time cardiologist. The ministry is currently advertised to the region as one of it's been on a PSC package, but as far as I understand, no one's applied yet.
How important is it to have a cardiologist?
Very much, like in terms that because it forms a large cohort of patients that we refer for overseas treatments. So cancers, heart conditions. So it really helped us to have a full time to help us detect early and.
So whatever they use,
He's the only one who's.
Do you think having a cardiologist, a full-time cardiologist, is causing some issues with patients, like being any medical issues with their hearts detected too late?
You could say that. So we a lot of things we're having to send to New Zealand to do other scans. So with the team here, we're able to scan a lot more hearts of people, and that's really assisted too, especially the valvular heart disease, the rheumatic heart disease. Yeah, so that's a big help for us. Yes, we definitely do need a full time. Yeah, it'll assist us with the management of the patients. Yeah.
Yes, maybe the next team, the cardiologist will do better. No, yeah.
maybe next time your cardiologist will be able to stay here permanently.
Stay here. Maybe.
Just to help us.
What are some common medical issues that you see during your time here? Being here for you're living in May, but still a lot of time to identify some of the most common diseases or health issues in some people.
So common disease. Common diseases, one is ENT, one is heart disease. Yes, many.
The common disease.
Many patients with hypertension.
High blood pressure.
Yes, high blood pressure, diabetes.
So
Just the
NCDs.
overnight,
Yes,
NCDs,
yes,
okay.
Yeah.
Any advice to the locals?
Because last time we go to Samoa Island to do free medical school. Yeah. Last time 17th February. Yeah, we go to Samoa. And we talked to the minister. I don't know which minister. That maybe one, officer. And they said maybe we need to take more attention to not only the patient, but also to educate the people. How to have a healthy diet. How to prove ourselves. Maybe that's important.
This is the most difficult country. That's what they've been doing in the last how many years?
That's right.
And it seems like our people don't listen. It's always been it's always been a non-stop awareness of looking after yourself.
Right.
But then we have people that have big appetites, and food is our Food is life.
I think she's testifying. Wasn't she?
Yeah, I was
As you can see, I love food. So
Yeah, we all
it's
love
not
food.
until that we really get sick, then we realize, okay, what I'm eating every day is just wrong.
Yeah, we all like food. Entirely fast food. High energy, high sugar. Yeah, we all like. Because that's life.
Thank you, Dr.
Yeah.
Thank you. Thank you so much.
ไม่ทราบหรอกครับว่าในประเทศเวลาแต่ว่าไปเปิด press release